Item 5.5, which is the first reading of the Board of Education policy, actually policies. Dr. Conway or policy chair, who wishes to, Mr. Kelly.
Well, the reason you're seeing these, it's our process to present what is in fact a new policy to the full board on one evening so that you have a greater opportunity to reflect on what is a new policy. And in this evening, there are two. The other policies that were passed earlier are either reviewed or revised policies. A revised policy means we changed something we had, and a reviewed one means it's exactly as it was before. We're just dating the fact that we've spent the time to look at it again and decide that we're going to stay with it as it was, in other words, status quo. So you see two before you tonight, one of which has to do with the discipline of students with disabilities, and it went through a lengthy process involving Patty Buell. And the second one is the policy that Mr. Lemoy has helped us with, and it has to do with electronic messages. It is labeled a draft. You're welcome to look at it this evening. There's no expectation that you would act on it. As I said, it's a process that we're trying to go through. And if you have any questions on any of them, now would be a good time to ask. These two will come before you again at a subsequent Board of Ed meeting where we will ask for a formal vote to adopt.
Board members, you've had a chance to read the proposed policies. Are there any questions of the policy committee or comments that you'd like them to take back and consider? If so, this would be the time. Mrs. Arnold.
It might be helpful for the board to know that Mrs. Buell explained to us that the policy regarding discipline of students with disabilities was all legal language. That's nothing that the board developed or wrote. It was, and Mrs. Buell suggested that we adopted the way it's written without any changes.
Thank you. And I did note all the references were at the end of that particular policy, and there was a lot of them. Okay, if there's no questions or discussion, look forward to this coming up on a future agenda for approval. We'll move on to item 5.6. Thank you, Mr. 5.6 is RFP for school-based health clinic. Mrs. Dr.
Thank you. Thank you, Mr. Hull. Last summer, the board had a presentation by a group that runs school-based health clinics. They were writing a grant to receive from the federal government, and Vernon fit the demographics and the grant, and they asked if we would like to participate. So they came and they gave a presentation about what the school-based health clinic would look like and what it could bring to Vernon Public Schools. They were talking about Maple Street School and the high school for the first two. In the board's discussion that evening, the board asked about if this was a good idea for Vernon, if this was a good idea for Vernon, then perhaps there are other vendors that might be interested in this. And so the first step that administration took was to put out a request for information from a variety of vendors. We had 3 vendors actually speak with us, and it's a lot of work to put a request for information together. So only one vendor did complete that request for information. That's the one you have in your packet, and that is the same vendor who visited with the board last summer. We are now coming to request that the board approve a request for proposals to go out, since this was just information. And so the board would be putting out that proposal to ask vendors to create proposals for a health clinic. I would turn this over to Mr. Burkar or Mrs. Buell. They are both the contact people. Mrs. Buell, you actually probably have
And Ms. Buell, if you come up to the mic. Thank you. If you have anything that you wish to add.
Through you, Mr. Chairman, by way of process, we did look at additional costs to the district, and there would be, and you can see in the request for information is reflected as far as utility costs that we would bear, and that's just in this RFI. We can certainly restructure that in an RFP, and we would incur a small increase in our general liability because we're changing the use of the building. Obviously, that would be a factor when we actually look at it when they calculate our premiums and so forth. But we did check with our insurance brokers. Those were two questions that did come up from previous board meetings, wanted to follow up. At this point, we would now look to put it out as an RFP. As Dr. Conway said, it's not uncommon to get just one RFI because there's no contractual award made in there. But from a process standpoint, we're looking for the board's input, feedback on things that you want to see, things that you may want to take out based on the RFI that you've seen there, based on additional research you may have done, looking at other school districts or online and so forth. So with that, I'll turn it over to Mrs. Field through you, Mr. Chairman, for additional information.
I would just restate that there was a presentation that really described the need for this service to our students. There are many families who are unable to provide immediate medical service to our students, who then are impacted their ability to learn. They don't come to school ready to learn because they're not well. And we have provided you significant documentation that would indicate that there are plenty of students that come to school that are not well and are not able to receive the appropriate medical care that they need. There's an example weekly, multiple examples weekly of children that really need immediate service and are just not able to get that because of their family, whatever the need is, they're just not able to get that service. So we do feel as a district that it would be a beneficial service to provide to our students.
Thank you, board members. You've had a chance to review the request for information. Is there any discussion, questions, comments? Ms. Field?
I just have a question about the construction of 2 exam rooms at both the schools. Is that something that we would have to pay for, and where would that be?
Through you, Mr. Chairman, that came up at our facilities committee right before this body met. I would suggest we structure the RFP that this would be a no cost to the board, and certainly look at, from an added value standpoint, the utilities costs and all that stuff would be borne by a vendor, and there's no reason why we couldn't put that in our request for proposal when we go forward. It would be a recommendation that I would certainly make for the board to consider.
Thank you. I see Mr. Percy's hand. Mr.
I have a security issue with this. Is that going to be dealt with the construction, because you're going to have possibly other people coming into the building that don't necessarily belong there?
Again, through you, Mr. Chairman, I think that's a good point, and we would need to build that into the request for proposal as a requirement. There would be certain security standards that we were meant to have to make sure that there would be for lack of a better word, firewall between the school operations and the clinic operations.
Thank you.
Mr. Kemp?
The detail here came quite a surprise to me, as you know, because I said so an hour ago in the facilities meeting. Now, this is a representative RFI or an RFP.
This is an RFI. This is all
In any case, in it, thank you, in it, the description of what they would do has to do with the construction of an exam room and an office in Maple Street School, and an exam room and an office in Rockville High School. Now, it may be that we can stipulate being revenue neutral to this Board of Ed, but on page 4, folks will notice the facility plan here is where they describe what this particular vendor would propose to do in each of those 2 buildings. Now, maybe Rockville High School could absorb that kind of change in its physical plant. I don't know necessarily whether or not Maple Street school could, given the fact that we're currently considering all-day kindergarten and what that would do with regard to the room availabilities. Do they expect to add on to the building? I don't think that's going to happen. So that means it's going to happen within the building. Now, focusing on MSS for a minute, there are, as most of you know, pretty serious ADA expectations. Now, this is federal money, and federal money is going to demand ADA compliance, period. And I don't know, this is pretty early in here, whether or not we could, in fact, comply with ADA. Their timeline here actually called for a signed agreement. Their timeline in the back called for a signed agreement with the Vernon School Board in January of 2013. It's the 29th. So clearly their timeline is not going to happen. And all of that backs up into implementing in 2014. So I have concerns about meeting this vendor's timeline.
See, Mr. Kemp, we would start the process with an RFP, which does not tie us to that timeline at all. The RFP would state a whole timeline. This is just information as to what a timeline would look like.
I understand that. But I think we all need to think about the fact that there may be impact in this, especially in the case of Maple Street School, as to whether or not any other vendor, in addition to this one, would also require exam rooms and office space and so on, whether or not it's revenue neutral. I mean, that's what we would require, but the whole aspect of the space utilization.
Do you want to give Mr. Picaro or Ms. Buell a chance to give a response that the whole board might hear?
Well, he heard pretty clearly in our meeting an hour ago. I'm just sharing with the full board here what some of the concerns of the facilities committee were an hour ago.
Just wanted to be clear on whether you were looking for them to provide us information or if you were just providing us, you're providing us concerns to the board.
Yes.
Thank you. Just wanted to be clear on what direction you were going.
Mm-hmm. And they talk about the possibility of breaking into some walls at Maple Street, and as we know, when we do that, all sorts of surprises happen. And whether or not they are adequately preparing financially for the contingencies that you run into when you break into walls and ceilings and the like. That needs to be, especially a building as old as Maple Street, regardless of vendor, clearly looked at. That's it. Thank you.
Thank you. Mr. Picaro or Ms. Beal, did either of you want to share any insight as to what you may be doing in the RFP to address some of those concerns?
Through you, Mr. Chairman, as discussed at the Facilities Committee, this is the exact kind of discussion we need to have so that when we sit down and write the RFP with the board's permission, we include these type of parameters in there. Those types of controls will be built into the terms and conditions, scope of the board, with the RFP.
Microphone.
Thank you.
And just one other question, just to piggyback on what you were just saying, is, you know, the chance that it could be a portable facility. Does it have to be in our physical building, or could it be a portable facility brought on site? You know, we've seen that kind of thing.
Yeah, and actually in this proposal, they talk about a mix of using a mobile, I think it's a mobile dental van to come in. It's from past experience, it's very common that you'll see a mix, or in some cases it might be completely mobile. It'll be a visit during certain scheduled hours during the week. I think based on need, though, that's what's been driving this particular RFI and the grant application that they were working on. The need is so much so, and they're a business, they're running a business, and they say not for profit, but they're, you know, obviously there's money to be made, and they want to be in the black. So I think based on need, they're showing in this RFI that it would be fruitful for their business to operate in a more structured on-site capacity at both of those schools.